We are continuing our coverage of American Heart Month with important information on how sleep can affect your cardiac health. 1 in 3 American adults reports having trouble sleeping. Poor sleep is linked to an increased risk of high blood pressure, heart inflammation, and diabetes. Shelby Harris is a behavioral sleep psychologist and clinical associate professor at Albert Einstein College of Medicine. Good morning.
Thank you so much for having me.
So we're fascinated, obviously, by the subject here on this show. Explain how sleep impacts our heart.
So, like you had said in the intro, sleep really does impact our blood pressure, it causes inflammation, and then when we're not sleeping as much, we tend to have more of the hormone ghrelin that makes us want to eat more, and less of the one that tells us leptin that tells us to stop eating, so we eat more, we go for the higher sugar, higher fat foods, and that can lead to obesity and diabetes problems. So sleep is really important in regulating that aspect.
But a lot of people have problems with sleep disorders, like sleep apnea. That really is a contributor to heart problems.
Yes.
AFib and a number of others.
100%. Insomnia, which is not getting enough sleep even though you're trying, and sleep apnea, which is that snoring, that pauses in breathing that happens for men and women especially, and women don't often get evaluated for it. And that poor quality sleep really can influence our heart health as well.
I mean, I sit here looking at you, Shelby. I really do feel like dead man walking because I get an average of 4 to 5 hours of sleep.
How you do it.
I know it's not healthy. I get that. But I don't even know what I can do about it as long as I'm on this schedule. And you throw in hot flashes and it's a hot mess. So it's not just the quantity that's bad. You also have to focus on the quality of sleep that you get too, correct?
Yes, 100%. So what I also say to people is that, first of all, we need to try and get more sleep. That's important. But first, if you're struggling with that, work on the quality. So things like working on limiting alcohol, limiting caffeine, limiting the screens before bed, lots of liquids. That stuff is really important as well. And then once you have better quality, then we try to work on the quantity of sleep if possible.
So Shelby, here, a real life example, to do this show, I try to get 8 hours before I wake up, but oftentimes if I try to hit that mark, let's say going to bed at 8:30, I actually wake up way before
like
I
at 1 or 2 in the morning.
Right, so sometimes I'm like, maybe I should go to bed at 11, which will give me at least the full 5 hours that I might be able to get.
Yes, and that sometimes is better initially. And then what we actually try to do is, for some people, I might have them go to bed later, and then I might slowly have them go to bed earlier over time, as opposed to that shifting back and forth, because that can create a lot of problems for people as well.
What's your take on sleeping pills? I don't use, I'm afraid to use them, but what's your take on sleeping pills?
I think when it comes to sleep aids, they're not ideal for most people. We really try, there's an evidence-based treatment that I actually specialize in called cognitive behavior therapy for insomnia. So we try that first, 4 to 8 sessions for most people. There's apps,
What
there's
happens
books.
when you do that?
You work on it's not just sleep hygiene, but you work on the timing of sleep, like we were just talking about. We work on thoughts about sleep. A lot of people put pressure on themselves to sleep and they worry about what's going to happen if they don't sleep, and so we work on that aspect. But it's a very short-term treatment that has a lot of data behind it. And then if that's not working, then we might go to sleeping pills if we have to, but we really try to not use them initially.
I did, when I was in business, I used Ambien and Lunesta, and it did help me get to sleep quicker, but my days were terrible, and I just got rid of them because I didn't feel good.
Yeah, I often talk about sleep. Like, we want to sleep at night, but what's it supposed to do? It's supposed to help us with the day. So if you feel like you're a walking zombie because of some of these things, what's the point? What's the point?
Just real quick, sleeping, you talk about eting right before. I can't
now that
believe
doesn't make sense.
That does.
Then you're a fatty McFat.
I think you want to limit heavy meals, big meals, like a dinner before bed. But for some people, a little light snack, that mix of a protein and a carb. So for me, I often have like a yogurt that's sugar-free. I put a little bit of peanut butter and some raspberries in it. That's a really good mix to help you throughout the night so you don't wake up hungry, which a lot of people do as well. But
really
light snack.
Shelby, thank you so much. Shelby Harris.